Good afternoon, everyone, and thank you for joining us today for the Sleep Charge webinar, How Healthy Employee Sleep Can Pay Dividends for Your Company. I'm Megan Brooks, Director of Marketing here at Sleep Charge, and I'll be your MC for the event today. First of all, I wanted to go over some housekeeping rules for our webinar. This event is being recorded and will be sent out to you by email in just a few days. Your lines are currently muted. However, if you have questions, don't hesitate to type your questions into the chat box. And as time permits, we'll answer questions at the end of the webinar. And if we have a ton of questions, which we hope we do, and we don't have time to answer those questions, we'll respond to you directly after the webinar. Here at Sleep Charge, we believe in healthy sleep for all, hence our tagline, and we stand behind it. We are a complete sleep solution for your employees. Our personalized program is convenient and easy. We facilitate a discussion about sleep and health that engages your employees with the knowledge and personalized assistance they need to ensure better sleep. Sleep Charge by Fusion Health is a comprehensive end-to-end sleep solution that includes sleep education, cognitive behavior therapy, insomnia and behavior sleep care, sleep apnea and breathing care, restless leg syndrome care, family sleep support, stress and emotional management sleep support. Our solution brings together technology, science, and validated protocols, together with medical sleep professionals to create the first virtual center of excellence for sleep. In our webinar today, we're going to be diving into some best practices of why duration, timing, and quality of sleep is essential to your employees, success at work, how sleep is associated with the greatest healthcare costs and mortality rates, and rounding out on why focusing on healthy sleep for your employees has a proven ROI. Joining us on the webinar today is Dr. Jeff Dermer, the co-founder and chief medical officer of Fusion Sleep. Dr. Dermer is a systems neuroscientist, neurologist, and sleep medicine physician with extensive expertise in technology-enabled sleep health delivery systems. And along with Dr. Dermer, we have John Pryor, the Vice President of Human Resources and Safety for Southeastern Freight Lines. John has over 30 years of experience in the transportation industry and has worked for FedEx, Werner Enterprises, and Cardinal Logistics. He also serves on the board of directors for the North American Transportation Employee Relations Association, where he also serves as executive director. So with that said, we would like to begin with Dr. Dermer, who can kick us off.
Okay, thank you, Megan. Thank you very much. And I guess you got a quick glimpse at our pictures there, so that's a good idea, just a quick glimpse. I'd like to, first off, talk a little bit about thanking you all for being here, because this is the first in our fall series here at Sleep Charge, and doing a webinar series really around the issues of sleep in the workplace. And I'd like to thank John Pryor, our first guest, because he is also probably one of the most well-versed individuals in the workplace who has actually put together a sleep program for his company, Southeastern Freight Lines. And our relationship, John and I, goes back, I think, almost a decade at this point, probably around 8 to 9 years. And I've learned quite a bit from John over the time. He's really pushed us to really demonstrate the effect of sleep in the workplace. So a lot of the discussion today will really be driven by what John has done to really help us to push the boundaries of this field. And what we'll do first, though, before I bring John into the discussion, because he's going to be much more interesting than I am as we go through this, I'd like to start off with the next slide, which is really just to talk a little bit about sleep and try to characterize really the understanding of why having a sleep program, or what a sleep issue is in the workplace. And this goes back to some of the basic neuroscience, which we have a little bit on the next slide, about sleep itself. And it's one of the fundamentals, as we all understand, but it's one of the fundamentals. It's also also one of the most difficult to understand because we understand diet and exercise quite easily. You can see the impact of those things on your life, and you know what those are because you're doing them while you're awake. But what happens at night is often very difficult for people to quantify and understand. And so just to start off with a little conversation about that, I think then it will help us all to be on the same playing field in terms of understanding what John's done in his program for Southeastern Freight Lines. The first thing is sleep duration, and these are all factors, these three factors: sleep duration, sleep timing, and sleep quality, that add up to really what it is your sleep does, and we call that your sleep charge on a night-to-night basis. So sleep duration is something that you all probably know quite a bit about, how many hours of sleep you should be sleeping and how many you're not sleeping on a night-to-night basis. The average American working adult should be sleeping between 7 to 9 hours based on CDC and National Institutes of Health recommendations. And what we know now is that around 35% of the workforce of working adults is not sleeping at that level. They're sleeping less. And the average actually over the course of the entire workforce during the work week is 6.2 hours. So 6.2 hours is our average work week sleep time. And it actually has changed dramatically in just the last 60 years. We know going back to NSF-based poll data from the CDC back into the 40s and 50s, people were sleeping on average about 8.1 hours. And so, you know, if you think about it, if you've been around since the 1940s, I don't think your genetics have changed so much so that your sleep duration needs have gone down. It's really us that have changed based on our environment. And that duration issue is certainly a factor. The other is sleep timing. So when you sleep, and this is something that we see in the workplace, complicated by things like shift work and some of the problems around shift work and managing your weekends. But it's also something we're seeing just based on the way our work culture has evolved over time. If you look back into the 1970s, back when 7-Eleven started, if you remember the reason for the name 7-Eleven, it opened at 7 a.m. and closed at 11 p.m. That was quite a remarkable feat back in the day, but you know that would put them out of business today if they weren't 24/7. So sleep timing has become an overall issue within our workforce as well as the adults in the United States. The last part is sleep quality, and sleep quality is probably more of the black box than anything else, and that is it's something that you might not understand why you're sleeping poorly because you wake up and you just don't feel rested. And you know, some people know a little bit about their insomnia issues or their insomnia symptoms, but things like sleep apnea and restless leg syndrome and the other things that Megan mentioned at the beginning that Sleep Charge has been built to manage, along with a lot of other sleep disruptors like pain and difficulties with stress, those are issues that really sap your quality. And so understanding those three is a good way to approach any discussion around sleep and understand what the effect of that is on your sleep. So with that fundamental understanding, I'll move forward and talk a little bit more about how sleep affects your health. And this is something that we've been doing quite a bit of research on, and I know John has seen this slide probably ad nauseum because we've talked through it many times in the past. But what we know from many studies, and just a few here are referenced down at the bottom. If anybody would like those references, I'm happy to provide them. But what we've known from this neuroscience and also the sleep medicine, circadian neurobiology, is that when people don't sleep well, it not only causes them to feel like they can't do well during the day and perform well during the day, or they feel moody, or they might feel a little depressed, it also causes and contributes to a number of underlying diseases that turn out to be very expensive. And so if you look on the left side here, conditions like AFib and type 2 diabetes, hypertension, stroke, and transient ischemic attack, depression, they all within those populations have a much higher prevalence of folks that are not sleeping well. And those people not sleeping well are actually contributing to the underlying cause of those conditions. In fact, if you go to a cardiologist because you had AFib, you'll find that one of the first things that they do is they send you for a sleep study to check you for your sleep quality, because that's the one thing you don't know much about, right? And sleep apnea tends to be one of those very common conditions that is undiagnosed and causing some of those underlying issues that lead to AFib. Same thing's true for obesity, coronary artery disease, gastroesophageal reflux disease, even coronary artery disease, which we know is a very complex beast. It's something that clogs up the arteries of your heart and can cause heart attacks. that's something that we have seen actually contributed to, and even in some cases caused by these sleep disorders themselves. Heart failure is a smaller population of folks, thank goodness, but it's also well known to be caused by sleep disorders like sleep apnea, which can be reversed and actually affect the heart in a positive way. And then underlying metabolic syndrome, for all of those reasons, actually, we know that a large proportion of folks with those issues are also with not sleeping well and having sleep disorders and sleep disruptions. The outcome is on the right-hand side, which is when we look at the healthcare costs of individuals in these populations, and this is something we've done with over 1 million people at this point within the Sleep Charge program, looking at companies as diverse as trucking companies like John's, as well as technology and services companies around the country. We find that folks that have sleep problems, like sleep apnea here in the blue bar, usually cost around 2 to 3 times more than the rest of the population. And that's one of the reasons that going into a population, finding these issues can really be a benefit. And John will tell you a lot more about his experience in this area. And then we look at specific conditions like diabetes, hypertension, and coronary artery disease, which we know are enhanced with sleep issues. People with diabetes and a sleep issue, which you see there in the green bar, that's a group that costs a lot more than folks with just plain old diabetes and no sleep issue. So 40 to 50% more cost being driven just by the sleep problem alone. So that's something that trying to get ahead of actually can reduce the cost of care for folks with these conditions themselves. And we'll talk a little bit about how that affected actually the Southeastern Freight Lines population. On the next slide, you'll see the fundamental of safety. And this is really specific to our discussion today, and something that I know John will comment on here as we get through this last slide here before he jumps in, because this is one of the underlying effects within the population that John serves in his company, which is professional truck drivers. And we see the same with airline pilots in those companies as well. And that sleepiness behind the wheel has been noted to increase risk for accidents by as much as 256%. This is something that if you look into the literature, it's about the same as the effect of alcohol intoxication behind the wheel. So the risk for having an accident behind the wheel is as much as drinking alcohol when you're sleep deprived. And the most common cause of that in the literature is that you have sleep apnea that's undiagnosed and sleep deprivation caused by that sleep apnea. Over on the right-hand side, the bar graphs that you see here are from a recent study where a sleep laboratory with hundreds and hundreds of truck drivers were put onto therapy for their sleep apnea. And what they found is that after a year, and this is after a typical year using PAP therapy on their own with a little bit of support from the clinic, they found that only 11 to 53% were actually using their therapy at the end of a year. So the biggest issue here is that we have conditions like sleep apnea that are addressable and that we can actually affect and reduce the chances of downstream safety issues, but people are just not getting the care in the typical environment. And maybe we'll talk a bit
Dr. Dermer, for some reason you cut out. Are you back?
Sorry, for some reason I was muted by the program. Sorry about that, folks. Yeah, so I figured you'd heard enough of me by now. So
No.
yeah, so the last thing I wanted to mention was that people using PAP therapy really are not getting effective therapy out there, and those are truck drivers. Actually, they're showing that their inability to get care because they're on the road, because they have a very mobile job, and their lifestyle really puts them at risk for not being able to use their therapy on a regular basis. And that means that at about an average of 1 year, people are not using their therapy to a very large order. So you only see about 11 to 53% of folks using their therapy. And this is a safety issue, and this is one of the fundamentals of safety, and that is being prepared to get behind the wheel. And so let me stop here for a second and bring John Pryor into the discussion. John, are you there?
I am here. Good afternoon, everyone.
Excellent, excellent. Well, thank you again for being on our program today. And I think we might be having some technical difficulties here. Can everybody hear me?
Yep.
Yes.
Okay, good. I'm getting some interference here on this end. Must be sunspots.
All right.
A little bit about. Yes, I'm here. I'm sorry. Is it still a problem? Can you hear me now?
Yes, you sound good.
Okay, great. Sorry about that. I think we're having a little sunspot problem. So I just wanted to see if John, if you could tell us a little bit about Southeastern Freight Lines, and way back before you started the program, what were some of the basic driving factors, the primary factors for Southeastern Freight Lines and for your interest in a sleep program?
Well, the initial interest was initiated by safety. We were concerned regarding the ability of drivers getting good rest and being safe, especially those that are in our line haul operation that are driving in the middle of the night. And as we started learning more about sleep apnea, and particularly as plaintiffs' attorneys started learning more about sleep apnea, that increased our interest and motivation for learning more about it. And as we learned about the obesity and its connection to sleep apnea, we went in and we looked at particularly our line haul group, and we looked at their DOT physical, the most recent one that we had on file, and we found that over 57% of our line haul group was obese, and so that caused us concern, and we were trying to figure out what can we do to protect them and the company. And we started researching sleep apnea and talking to other folks about sleep apnea programs. And I think Schneider National was one of the first carriers to introduce a sleep apnea program, and I talked with them. And they're an over-the-road trucking company, and they're very different from an LTL operation. So we had different challenges, but their results from the sleep apnea program that they implemented were exceedingly successful. And quite frankly, they were giving me numbers and information that I doubted. I said, I love y'all folks, and I think you're a great carrier, but you know, these are extraordinary numbers. This is really hard to believe. So I said, you know, I must have some relatives who've been from Missouri some way, because I said, somebody's got to show me, and I got to see my data that will demonstrate the effectiveness of a sleep apnea program. So we began to search, and we found several challenges that to implementing a sleep apnea program, and one of the main ones was logistics. We have 90 locations in 13 states, and trying to find a vendor that would serve all of those locations, we couldn't find one until we found Fusion Health. And at that time, you know, y'all accepted the challenge of putting together a program that would enable us to test people regardless of where they were located. And because we didn't want to go through, 90 different locations, 90 different billing processes, you know, 90 different compliance sets of data. We wanted it all unified, and for simplicity's sake and for efficiencies. And y'all provided that. And so we began our adventure together in this program, and hopefully we can show the folks today the overall success that this program has been for Southeastern.
Yeah, and that's a good point in terms of the coverage for a program that has to be in many, many states all at the same time. And that one of the things about Sleep Charge, for those that don't know, is that this is a program that's based on a workflow platform. So all of the care and all of the components of the program are brought directly to the individuals wherever they are, and then also allows the individuals to connect back as well as be connected to care coaches. And those sleep coaches actually manage all of their needs, including even resupply of their device needs if they're on a therapy for apnea in particular. So the good thing of technology sometimes is also the bane of our existence when we get disconnected through our webinar, but it does have a positive effect when we're looking at bringing sleep healthcare within a mobile workforce that's distributed geographically, for sure. So I think on the next slide we have some information, John, specifically about your safety outcomes. So maybe we can talk a little bit to that.
When we were talking about implementing this program, of course, as any company that is going to implement one of these programs, cost is always a factor to be considered. And when we were having this discussion of implementing our program, one of our competitors had an accident, of which sleep apnea was one of the primary focuses of that lawsuit. And they settled that case for a little over $40 million. Wow. It was a traumatic case. And so when we were looking at this, we had basically two goals. We wanted to, most importantly, improve the health of our employees, and two, to protect those employees and the jobs that they had by reducing the risk that a potential accident of someone having sleep apnea might cost the company and cost employees their livelihood. So once that happened, we said, we can buy a lot of equipment and a lot of services for $40 million, and we think this is a good program to implement, a good risk investment to make. And so we did start the program, and we started it on a voluntary basis, and we had people to enter the program. Once they entered the program, we had a very solid policy that we communicated to all the folks. We simply rolled it out after we had a few volunteers later on, where we went and we met with every employee at every location to cover this program. And we incentivized them by offering them $250 if they would take, if they felt they had sleep apnea, they wanted to volunteer for the program, they volunteered and they tested positive, we would give them $250. But once they tested positive, then continued compliance with the program was mandatory. You couldn't opt out or unvolunteer, as some might have wanted to do. You had to be compliant from that point forward. And as we started looking at the participants versus the drivers who were not in the program, and we did a study where we looked at the age, we looked at the conditions that a person may have. So if you had someone who was 40 years old with a type 2 diabetes that had a BMI of 40, we tried to compare that person to a similar person who was not in the program of the same age, same type 2 diabetes, that had those common comparisons. So we looked and traced their accidents over a period of time, and you can see on the chart, as the years went by, we've had people leave the company, retire from both sides. So if you do, you had a smaller number as the years progressed. But you can see the difference that the sleep apnea program has made in the reduction of accidents for those that are participating in the Sleep Charge program versus those who were not. So to us, that clearly indicates they are a higher risk at having an accident if they have these conditions and very likely to have sleep apnea. So we strongly encourage all of our drivers now to participate in our program. And we currently have over 700 drivers in our program that have been diagnosed with sleep apnea and are continuously undergoing treatment and are monitored in the process. So we're very pleased with those results, and we think that has, of course, somewhere in there has been accidents that have been avoided, and we are thrilled about that. It's just we can't identify exactly which ones those have been avoided, but we know they're there.
Yes, absolutely. And the slide we're looking at right now does track it for 5 years, and I think what people can see here is, over the course of time, we start off with pretty much the same preventable accident rates for the drivers in the program as compared to folks who are not in the program, actually, just sort of the regular drivers out there. And the diverging curves here really kind of demonstrate the story, right? This is what we've been showing over the last few years, that preventable accidents in particular, and maybe you can define that a little bit more for us, John, because I guess every company has a different way of divvying up what accidents are and incidents.
Yep.
But those have really come down and stayed down for years.
Yes, we define a preventable accident as basically any damage to a third party's property for which there is a claim filed. And if we hit, let's say, our own equipment, if there is an excess of $250 damage to our equipment, struck by our equipment, then that is an accident as well. And the preventability is did the driver do everything within reason to avoid that collision? And if they did not, then that's preventable accident.
Got it. Okay. So, what this is, it's difficult to quantify the outcome in terms of the actual dollars, I suppose, but, I guess you've seen enough from other companies to make this a stimulus to start a program. In terms of other reasons, and you mentioned healthcare, we talked at the start of the discussion that healthcare itself is one of the main fundamentals that sleep adds to. We can show maybe a little bit about those outcomes as well. And have you heard from the folks in the program what the effect has been on their health or how they feel in the program?
Absolutely. But before I jump into that, I will say that we have an annual meeting with our actuary. And our actuary analyzes 10 years of accident and injury data that we have had. And you can look, and he came in the year, or actually it was 2 years after, because accidents have a long tail for costs that go out over time. And he said, what did y'all do right here? Because something changed right here in your accident data, which gives me, I'm going to say and project that this year you need to project your retention to be less than it was 2 years ago. And then we told him about the sleep program we'd implemented, and he could see it in the numbers. So not only is it numbers from our health side, from our accident side, our actuary, even a third party outsider says, oh, I can identify something has changed in your process. And so that also was encouraging. But to our health, that is huge for us, because if we can demonstrate to our employees how much we care about them, and that we're concerned not only about them executing duties at work, but having a better quality of life and being able to live longer, enjoy life, and retire in reasonably good health. We're trying to encourage people to do that, and this program is a great way that people can see immediate results. When I say immediate, I'm talking about, and I'll give you my personal experience because I have sleep apnea myself. And after I first got diagnosed, got the equipment, after the first week, I really couldn't tell really any difference. But about week 2 and 3, I was feeling better. And it just, you know, it was something that I could tell. Now, if I have, of which I also have, I'll give my whole medical history here today, but I also have high blood pressure, and I take a high blood pressure medication. Well, I don't feel any different before and after I take high blood pressure medication. I cannot tell that is doing anything for me. But when you have treatment for sleep apnea, you feel better. And we have had drivers who have written us letters and emails and called us and said, "You've really made a difference in my life. I feel better now." And from spouses who can now sleep better because the spouse is sleeping better and not snoring and waking them up throughout the night. So we've had some people who went into the program sort of kicking and screaming because they had been flagged by a DOT physician, you got to have sleep study. Well, I don't have it. Going through all of the, the verbal communication of resistance that you would expect from a 5-year-old asked to eat broccoli or something. They go, they get it, and then they come back a few weeks later and say, "Oh, this is wonderful. I wish I'd done this years ago. I feel so much better. I can now have some energy to play with the kids when I couldn't a while ago." So not only just the testimonies of feeling better, which helps sell the program. Those were huge advocates for us when we had some of our folks being cheerleaders to others on the team of, "You really need to do this." So we tried to take advantage of that in our communications and share results. And we did kind of stories of, we had people who lost, 100 more pounds, where they now felt well enough to exercise and start losing that. So there were some dramatic life changes as a part of this, which is very encouraging and personally rewarding when, as a company, you've positively impacted somebody's life, and they're very grateful for that too, and the family is as well.
Yeah, those changes in just the way people see their life and the quality of their life, those are kinds of things that really are the intangibles that actually can be measured, and those are the things that we've been measuring with quality of life assessments in the Sleep Charge program for a few years. But you just mentioned in terms of like the effect that it has on the company, and I think we have a slide here that talks a little bit about the effect itself within Southeastern Freight Lines. And this was really about looking at the cost of folks in terms of healthcare claims. And, one of the biggest differences, I guess, in terms of individuals who are in the program versus those that are not in the program is that the folks that are in the Sleep Charge program are sleeping better than they ever have before. But, can you speak to this trend, this change in cost and the effect that had internally at Southeastern Freight Lines?
Oh, yes. We all know healthcare costs continue to go up, and every organization I know and talk to is struggling with that challenge to try to control these costs. And what we found, and you can see these are, when it says 2016, 2018, these are kind of blended years through March 31st, 2018, since we haven't completed 2018 yet. So these are 3 years worth of data, but you can see that the non-participant trend of which we have in our plan over 6,900 employees. We have many more in our plan than that, including the families. But you can see the trend of the cost is going up at 17.9% over this period of time, while those that are in the Sleep Charge program, they've only increased 7.5%. So you can see by this, there is definitely a financial savings, and that's what I was somewhat referring to when I was talking to Snyder. They were giving me some numbers of, oh yeah, we reduced accidents, but we also got the benefit on the medical plan. We saved a lot of money over there, and they were giving some figures, and it's like, oh, that's really extraordinary. Hard to believe, but it's extraordinary. Well, we started doing our study, and we found the same thing. So we were very encouraged by this program.
Yeah, it's actually kind of remarkable if you think about, up front when we were talking about the cost of people, in the general claims data that we all have seen being, 2 to 3 or even 4 times more expensive than the average individual. If you were seeing the average individual being more expensive than folks being treated. So it does get to the understanding that, when you treat sleep issues as a fundamental of health, you get downstream effects across the board, not only just in general costs, but even in specific drivers of cost. And I know that, diabetes in particular is one of those areas that we have seen significant change. And you guys have some of your own data here that to share as well. Again, more of the blended trend, but maybe you can talk a little bit about, what this has meant to the company.
Yeah, we were looking at the comorbid conditions that go along with sleep apnea, and this is true with all of our health plans. These are the areas that are generally the most costly in your health plan. You're spending a lot of money on these conditions, and you could see here the first year, it went up maybe even a little higher, which literally surprised us a little bit. Then it takes some time for this to take effect, and we have seen those costs decline. As you can see, there's a difference here between these two numbers of over $2,700 on average per member per year. And if you multiply that out times your 141 sleep charge patients in diabetes alone so far in the 2018 year that we have that we're looking at here from April of 17 through March 31st of 18, that is in excess of a $384,000 savings on this condition alone. So you're assuming that, if these people were not treated, that cost of $15,000 or almost $16,000 per member, it probably would have been higher than what it is on that chart. But with that treatment for the 141 people in our program, that's $384,000 of impact right there. Yeah. You can see the difference of a 38% increase in the non-treatment versus a 13% in the treatment. As I said, medical costs are going to continue to go up, so we don't expect this to go down, but we're just trying to control the amount of the increase year over year. And if we can do that, that's a success.
Yes, absolutely. And one of the things that definitely from the clinical perspective, what we've seen with people with things like diabetes, once they get treated for their sleep problem and they get it under control, it usually is also apparent to them that there are things like taking medications that they haven't been doing. So initially, most of the cost in that first year, then you see a slight increase compared to the other group, the non-participant group. We've often seen that that's basically related to people preventing or using preventive care services. So it goes right to the argument that, not only is sleep at the core of causing some of these problems, but it also allows people, once they get their sleep back, to take better management or control of the management of their issues. And they tend to take their medications and have the effect over time. So definitely something we see within diabetes. And we also, I think we looked at a number of other condition states within the Southeastern Freight Line population, the next one being coronary artery disease. And again, not as big of a population, only 48 people really in the sleep charge participant group compared to 268, but a very statistically significant difference between the groups over time.
Yeah, it's a huge dollar difference. I mean, look, you're looking at almost $27,000 versus $17,000 for those 48 people, and then that was, a much quicker impact on this particular group. So if you look at that and calculate that cost savings, that's over $464, almost right at $465,000 for that small group of 48 people that you have impacted here, and that's a major difference in their life. And you can see the overall cost has gone down for that group almost 8% from where we were 2015, 2016 when we started collecting this data. You can see there was a slight difference in the beginning, but this is pretty impressive story, I think, here.
Yeah.
And so you start adding up bigger dollars here. This is conditions that will take people out of work. They will lose their ability to work, going on short-term disabilities, and having to retire and get out of driving. And we all, in our particular industry right now, we all need drivers, and they're a precious commodity. And so we have to do everything we can to try to keep them healthy and being able to contribute to the team.
Yeah, absolutely. And your point about actually seeing a change quickly comparatively with diabetes, it really does underscore what we know clinically about treating sleep disorders and in the population with heart issues. And largely what we're doing is reducing that hyperarousal, that systemic vascular inflammation, really right away. And so within a few months, you see changes in the heart, you see changes in blood pressure, and hypertension is another population you see, overlap with coronary artery disease. But I think we tracked that one as well. And in the hypertension population, you saw exactly what you just mentioned, an immediate change. And here again, a pretty dramatic difference in the cost, but also these are much larger numbers of people, right?
Right, larger number of people, a little less difference in the cost, but we've had so many people also being able to get off their medication and being able to share that with us, and how happy they were that they didn't have to take that medication anymore because of the impact of the Sleep Charge program. But you can see here again, it's a reasonable. It matches what common sense would tell you. We've had a decline once we got people involved in the program, and then they're maintaining their participation in the Sleep Charge program, but naturally medical costs are increasing, and that's what this chart will tell you. So with our difference there's basically a $2,064 difference between those two lines, but with 339 people, that actually calculates out to be a $699,696 savings for this particular group. So virtually right at $700,000 for the group that we're talking here. And the language of business is numbers, and data is huge in business. And so this is something we wanted to see. We have gotten what we feel are very satisfying, exciting results from what has been implemented here. Our folks are pleased with the program. We're getting a lot of positive feedback on the program, and our compliance on a weekly basis is consistently, week after week, in the 97-98%. So our folks are using it, and when you look at our data and look at that compliance, they're just not using it the minimum of 4 hours per night. They're using it the entire night, which is what is contributing to them making a difference in their health and their life. And so we're very excited about how well they have embraced the program and are actively engaged in executing the compliance aspect as well. And the coaches really help people get compliant through their acclimation period, and they work with them to get the proper equipment, get it set at the right pressure, get everything working satisfactorily so they can be successful. And that was a key differentiator from your program from others that we talk to. It is that nurturing, caring, hand-holding that us big old male adults need sometimes to be instructed. Here's what you need to do. Here's how you need to do it. And ultimately we'll do it. But that makes a big difference. And so my hat's off to that team.
Well, I thank you, John. That's we're really pleased with these outcomes too. And having been a neuroscientist and a sleep researcher for so many years, we've known this effect, but we've just not been able to show it in real world populations before. So I thank you and Southeastern Freight Lines for helping us to demonstrate it, because the outcomes, we knew they would happen. It was just a matter of showing just how it would happen, and the timeline and the cost of it and the benefit and the savings really are driven by compliance. And as I mentioned in the beginning, only 11 to 50% of the folks out there right now in the trucking population are using their therapy on a night basis. But again, in your program, it's 90 plus 95 to 99%, depending on the day we left. So it really is it's a really different construct. And one of the reasons that we actually make this change, I think, in terms of the individual's diseases that they currently have, like diabetes, is not just because of the sleep itself and there's something happening at night. It's actually that what sleep normally provides us is that anti-inflammatory effect, and it reduces that. I mentioned systemic vascular inflammation earlier. Well, there's a lot of conditions that are made worse, diabetes one of them, by that vascular resistance, by the change in insulin receptors overnight. And a lot of the complications of diabetes, and we measured this in your program, those complications of diabetes are controlled. So when we look at complication rates, and this is directly from the Southeastern Freight Lines population in their medical data and their health claims, we found a really incredible story, and that is all of those diabetic complications like atherosclerosis, people going to the ER for their diabetes urgent issues or emergent issues, kidney issues, even heart failure and having problems with other end organs, eyes and nerves. Those things actually were substantially reduced. So now we're getting more control of a condition that oftentimes can wind out of control. And I suppose that's another area, that as we look at the other conditions like hypertension and coronary artery disease, even things like depression and mood disorders, where we see complication rates dramatically reduced by restoring sleep, we also can see this. We can see the change in the cost of care. So this is really another part of the story, I guess, but it sort of unveils a little bit more of the ability with the Sleep Charge program to see this information. And is that, looking at this construct within your driver population, has it led you to a sense of, perhaps this is maybe something for all diabetics at Southeastern Freight Lines? Is this for all folks at Southeastern Freight Lines, or how do you think the companies perceive the program at this point?
Well, we've taken the approach that one of our major objectives is with like diabetes is we know that if people don't take care of themselves, there is a natural progression of that disease, which leads to further complications, which leads to more expense, more medical treatment that has to be had, and it is not a positive result long term. So our objective is at least stop the condition where they are and help the people not get in worse condition. And so when we have these complications, we're very concerned about that, and the sleep program has helped them stop that progression of the disease in many instances. Where you can see here, there's a direct X marks the spot on the chart. There is a difference when you're being treated with sleep apnea, and as you said, as one of the underlying factors in the diabetes, and those that are not being treated. So as a part of our just natural concern and care for our associates, we're very excited about what this program has done, not for our drivers, and now we've rolled it out to our entire population for those that want to participate in this program. I do want to say just cumulatively, so that people can get an understanding. When we look at the diabetes, the coronary artery disease, and the hypertension, I think I gave you some numbers on the savings of each one of those. When you add those together for the past 12-month period that we looked at here, that's $1.5 million that we perceive in savings out of this program. And you know, you take $1 million here and $1 million there, and pretty soon you get some outstanding results for your corporation on the financial side. So it has been great for our associates from their personal perspective. It has been great from the company for financial strength perspective and our overall health care for them. So I can't label it anything but a success from our perspective. And I would want to say this to folks that in collecting this data, that this is not Fusion Health's calculations. We have agreed upon a third party where we feed our health claims to the third party, and we feed the sleep program to the third party, and they take all of the data and do the analysis and the calculations and provide us this result. So this is from a third party, so I'm trying to remove if there's any bias in the data that you've seen here.
Yes, absolutely true. And in fact, that group has done quite a bit of research on their own with a number of companies, specifically around healthcare costs and sleep itself. So they've really they've created a way to visualize the impact that we've all in science knew about, and that we were hoping to see in the business. And really, it's made a significant difference. And you know, I think we're coming to the close of our webinar today. But you know, before I open the phones up for questions, John, I have one question that I think might be on the minds of many of the folks participating today, and that's really about when you started the program back in the day. There must have been some different perceptions about what the different barriers were, what the sleep and fatigue program really meant to the company, and maybe sort of looking back now, can you say, you know, what barriers were real and which ones were perhaps perceived barriers?
Well, the real barriers that we had were the logistics piece that I talked a little bit about, and how would you administratively handle the program from the beginning. One of the artificial barriers I think we had to overcome was the fear of losing drivers, losing employees, and their receptivity to the program. And that just turned out not to be at all what we anticipated. I think the early success of the program, the fairly quick testimonials that we got, that we were able to share with others, so we were able to publicize success very early on, and that success just led to a little more success, and it just kind of snowballed. We expected, pushback. I'm not going to participate in that program, and we had to take a hard stand that said, if you were diagnosed, you must be compliant. And if you can't be compliant, you can't drive for us. And there was concern over how many drivers are we going to lose out of this. Well, all in all, after, the first year, I think we might have lost 5 drivers who actually just said, I am not going to do it, and we said, we wish you the best, but you're going to have to drive for somebody else. We can't take that risk. And, and so it just was not nearly the factor that we anticipated it to be.
That's great. And then, the year-to-year data that we have, just in terms of the folks that are in the program with Southeastern Freight Line, shows that, that there's very little dropout from people who, once they feel the support, or if you will, the love from Southeastern Freight Lines, they're dedicated SEFL folks. It seems for life. There's a real sense of what you were trying to drive in terms of the culture of care. So I think that was a great way to develop a program around that construct. And then rolling it out to the rest of the company really does kind of keep in line with your intention. So hats off to you, John, and what you've done at Southeastern Freight Lines. Yeah, it's amazing how you've taken a program designed to help people sleep and turned it into a way to keep them working. So, we'll open up the lines for folks to send some questions to us. I think we have a little bit of time here for one question. Now, I'll handle this one real quick because it was a good question about sleep apnea itself. And I wanted to know if we could describe a little bit more in detail the protocol of somebody who decides to participate in a sleep apnea program in particular. And what would the program look like? Is there medication involved? Does the protocol depend on individuals? And, I can say from the Sleep Charge perspective, and maybe John, you can answer from your perspective, but the protocol is pretty standard care, and that is the positive airway pressure therapy that we utilize in the vast majority of folks with sleep apnea is the way we handle sleep apnea. And the way people get diagnosed is by testing. And in the Sleep Charge program, that testing is brought directly to the drivers. It's actually brought by technologists distributed all over the country that bring these diagnostic devices. They meet the drivers where they sleep, which could be even the cab of their truck, but could be at home or in a bunkhouse. Test them that night. Next morning, the diagnosis is rendered if they have sleep apnea or not. When they get that next step, they either get a letter from the doctor saying they do or do not have sleep apnea, and then go back to the certified medical examiner with that letter. And if they don't have sleep apnea, they don't. And the doc can say that right there and then, because the test itself is not a home sleep test, it's a mobile sleep test, which is just like the laboratory brought to you where you sleep. And then those who get therapy will get it right there and then with the same therapist that did the testing. And then you're using what's called AutoPAP, not the continuous positive airway pressure, but the automatically adjusting positive airway pressure that will do a breath-by-breath analysis from that point forward every night you sleep with the therapy. And that data is uploaded to our platform in Atlanta, Georgia here at Sleep Charge. And escalation of issues are handled directly by the platform to sleep coaches. And those sleep coaches become well known to the individuals out in the program, become their lifeline, their support system. They really are the ones that provide the care. And that's why 95, 99% of the folks stay in their therapy, because they've got a resource. And we can automatically and remotely adjust the therapy directly through the platform. So it really does not require an individual to go to a doctor, to go to a laboratory, and continuously things are brought to the individual, including new masks and new therapy devices. Any change in their health or needs are addressed directly through that. So that's the nut and bolt part. There's really no medications involved in the vast majority of cases. And if there are, that's all handled by our sleep medicine core. So our physicians, all sleep boarded, handle those issues as they come up, just like they do with the PAP therapy, which is all prescribed. I hope that answered the question. But John, anything to add in terms of the protocol from the participant side?
The only thing that I would add that was very important to our drivers was that this can be done without them missing any work. So it can be done while they're sleeping at their normal times, whatever that schedule is. It was adapted around their schedule. They didn't have to miss any work. It didn't cost them out of their pocket. So there wasn't a penalty for doing the testing. And then they got the equipment, trained on how to use it, and they were off and running at that point.
Great point. Thank you, John. And I'll hand it back over to Megan. I think we've completed our webinar today. Thanks, John.
We have, and thank you so much, John, for your time and everyone who's on the phone with us. If you're interested in learning more about our program, just send us a quick note at webinar@fusionhealth.com. And within the next few days, a recording of this entire webinar, as well as the slide deck that you viewed, will be available and sent out. And then also, if you're interested in learning more, email us. We have a few more questions that have come in, so we will be reaching out to those folks independently with the answers to those questions. And again, thank you so much for your time today. Have a great one.
Thank you.
Thanks.